alumni McShin as well. So, yeah. Okay, recording started. So we're good to go.
Okay.
Okay. Hey everyone, Honesty Liller, CEO of the McShin Foundation. We're doing something a little different and we're traveling far to meet Dana here and talk about her services and her great organization. I want to go to your to your place right now for about a couple weeks myself. So I did some research on it. So, yeah, I just want you to introduce yourself, let our audience know who you are, and then we'll dive into what you do.
Okay. My name is Dana Hargus, and I have been a mental health counselor for the last 25 years. And I have a private practice in Ada, Oklahoma called Biofeedback and Counseling. And there are 11 of us, and we schedule about 1,000 appointments or more a month.
Oh.
And we have it just started with me and a friend, and then through the years I just keep adding one more and one more until we got to where we are today. But we're kind of known for doing biofeedback, and we can talk about that in however much detail you want. But one of the things that I think is important to note is kind of how I got to the point I was doing biofeedback. I started my career right out of college as a special education teacher. And when I was there and I worked with children and they had counselors and they took mental health meds and they took, they did all kinds of things for their behavior. Much of my time was spent with emotionally disturbed children. I think they've relabeled that in Oklahoma now. But basically, it was children who could not regulate themselves. And even some of my time was with delinquents and that were actually incarcerated, even though they were children. They were locked in a lockdown facility. So my feeling was is that the things we didn't work. And it just saddened me because it's like these children are children, like sometimes they were. I never taught little bitty kids. I mostly worked with junior high up into high school, and I could see that the things we didn't work. And then to make it, to drive the point home further, I was an adoptive mom that adopted from the foster care system. And one of my kids like struggled a lot. And I did all the things. We went to therapy. We did anything that Medicaid in Oklahoma would pay for, and then I would save money to do the things that the Medicaid wouldn't pay for. And I can't say that nothing helped, but it sure didn't do what I hoped it would do. And I felt like his life was hard, and there had to be a way to make his life easier, and frankly, to make my life easier. I wondered where we were going. It'd be like, if this is where we are in sixth grade, where are we going to be in 10th grade, and what are we going to do when he graduates? And so I had a lot of different motivators that said this model doesn't work. And during that time, I was considering being a school counselor. I just was thinking, I'm going to do some things, I'm going to make some changes. And I heard about biofeedback and I began to do some research, and I knew my son needed it. And I knew that in my state, only two people were doing it, and it was a private pay thing. And I didn't have the money to take him to do it. There was just way out of the range of what I could do. So I just kept clipping along at school until I got out. And then I began to do biofeedback with my son, and our results were amazing. And I was so pleased. And after that, I opened a private practice, and now here we are 25 years later. And I've created a new model because I still feel like the way we do things doesn't necessarily work like it should.
So, can you let us know what is biofeedback? Because I was just learning about that, and I've been in this field for gosh over 18 years. So, can you kind of unpack what that is for our audience?
Sure. So biofeedback is, simply put, exercise for the brain. And just so you have a visual of what it looks like, you're in a chair in front of a computer screen. There's actually two monitors hooked to the same computer. And there are electrodes on your head, but nothing goes through the electrodes. Like, you're not getting input in that way. They're on your head, so your brain waves actually go from the electrodes through what we call an amp into the computer. And from there, we basically encourage what we want and discourage what we don't want. And the way that looks, really the way it used to look, the technology moves so fast. And I feel like now people might watch it and go, what are you doing? But used to, it was very clear. And so I'll give a picture of what it used to look like so you have like a deeper understanding of what we're doing. And it's the day will come that I will say this and people will say, what's Pac-Man? And then I'll know my analogy is over. Because Pac-Man, like there was a game that looked like the old Pac-Man. And basically, when the brain was doing what we wanted it to, the Pac-Man ate the dots and the computer beeped. It would just beep, beep, beep along. That's like telling the brain, yes, 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 you're doing a great job. If the brain darted off and say made frequencies that increase anxiety or frequencies that indicate poor focus, the Pac-Man would turn black and wait. And that's no, 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 stop. And then the brain would self-correct and on it would go. Now, and back then, the time between what happened in the brain and what happened on the screen, there was about a 3-second gap. So the brain was getting that feedback, but there was a little lag time. Now there's 300ths of a second. Like the technology just brings us forward and forward and forward. So now, in a lot of ways, it's a lot more powerful. Because I used to tell people, give me 10 sessions and you'll see a difference. People see a difference in one session. It doesn't mean you're done, but you absolutely will get a definite calming effect in a session. People will say, I can't believe I came here once and I slept better. You won't sleep better forever unless you come back, because we have to tell the brain yes and no, yes and no. Now you can put a YouTube video up, any YouTube video, put a filter on it. And when the filter is wide and the screen is clear and the volume is strong, that's like telling the brain yes, yes, yes. And when the screen closes or the picture's foggy or the volume goes down, that's telling the brain no. So over time, just like you can learn to ride a bike, learn to play the piano, learn to do anything else, your brain can learn to function better.
Wow. So is there any like effects from that, or how long, I guess, can you unpack like what is your typical patient or client, whatever you call those, the humans that you serve, in if they did 4 sessions, like what is that teaching them like on average? I know you do a lot of adolescents as well. If you could let us know, like, does this have to happen forever? Do you have to get treatment forever? Or does your brain naturally start evolve into the process?
Yes, it is not a forever treatment. And that's kind of how I arrived at the restore of Ada, because I believe that, and I know that treatment done quickly and intensely benefits the brain more than a more stretched out mental health model. So most people that come and they're here once a week. If somebody comes in with significant issues, we might see them 2 or 3 times a week for a little bit. But our model typically in this outpatient setting is we see clients once a week. Well, I have no idea what periodically I have looked at how what's the average length of sessions. Frankly, I haven't done that in years. But people are significantly better in 20 sessions. Like, and it's not going to go away. When we tend to get people back is like when a new life event comes. Like a kid hits adolescence, or there's a divorce and mom's like, I'm not doing well, I'd like to come back in. I will say there are people that I lovingly say I just can't get rid of them. They're like, I love to come here, it makes me feel better, I like to talk to you, and they come like once a month for a long, long time. But they do not have to do that in order to sustain their gains. They just want to continue the service, and they do. Just like somebody who says, I just am going to stay in counseling, I'm not going to stop completely. But when the work is done more quickly, in conjunction with other interventions, just even thinking about things like attachment and what am I eating and what am I drinking and what things do what are my sleep habits and what what about fascia and how does trauma get stored in fascia? Just all of these different pieces that we've included in our new program lead us to a much faster resolution. With Restorative Ada, we give 5 months of biofeedback in 2 weeks. And so the brain gets such a fast overhaul.
Mm-hmm.
And really what we're doing is not therapy. Restorative Ada is not counseling because what there are just a lot of things that counseling doesn't fix.
Mm-hmm.
Talk and talk and talk. And I love counseling. I do counseling every day.
Yeah.
There are things that you can talk and talk and they will never get better. And it's more of the need to reset the nervous system. And that's what we're looking at Restorative Ada.
Cool. What about the I was reading your website. So what are they do they live there, the different phases of the program? I know you had two and then you had Restore Plus. If you could just explain to our audience what each of those are.
So the Restore program starts with 6 weeks at home. And during
Okay.
those 6 weeks, you do online things. We send supplementation in the mail that's more tailored to what we think the person needs. It's more of a not it's not so much of a supplement designed to solve a problem as it is to get the body to begin to detox, to get the
Mm-hmm.
body those pathways open, to improve energy. And we each person gets a real intense first interview that helps us see what do you need. Do you need more information about what you're eating and what you're drinking? Do you need to know about how to better connect with your child? Do you need to know about attachment? We really are attachment based and that understanding of how our own attachment affects every relationship we have. So, looking at all these things, for 6 weeks, we work with this person to get them as ready as they can be to come here for the in-person portion. It is not inpatient care. It's from 9 to 3 every day for 2 weeks, not the weekends. So 9 to 3, Monday through Friday. And our goal during that time is to get 2 biofeedback, an AM and a PM every day. And then when you're not doing your biofeedback, you're involved in educational things, you're involved in other forms of biofeedback, like heart rate variability. We've got some different things we do with frequencies and tones. We do PEMF technology. We look at trauma and how it gets stored in the body. We learn about what food would be most conducive to helping your brain and your nervous system do what it is we're wanting it to do. We work with the parents of the children. If we have children in a group, we work with those parents to help them know. When that is over, our follow-up is Restore Plus. And Restore Plus is an online forum that has all the things that Restore has except biofeedback. Obviously, you can't do that at home on your own, but the educational pieces are available there. So our hope is that that group or any Restore Plus is for anybody. It's only $7 a month. And we just want people to have access to how do I begin to work on my own self? How do I begin to help my child? And there are things for adults, there are things for kids, there are just practical things that you go, you find something, you work on it till it's better. There's also a live portion where it's like if there's an ongoing need there, we try to meet it. For instance, an adoption support group or just questions and answers, just live back and forth, because we want to meet people where they are and give them the information that they can begin to heal themselves.
That's amazing. What is an average stay? Like, does someone stay in your program for years, like in that the $7 a month or whatever, or do they tend to like stay in that for a while, then come back and do all of it over again? Like, what is your
Well,
retention rate there?
this entire program is new. That's why.
Okay.
So I have been considering the Restore Veda piece for about 15 years. Like,
Oh
because
wow.
I've just been
Okay.
busy in the private practice thinking
Yeah, I get it.
so
Mm-hmm.
many things that we could do better in a different model because insurance honors inpatient care and insurance honors like outpatient counseling, what I do, and medication. Like those models are kind of the standard of care. And,
Okay.
and I feel like so often I see that they don't work. Like what we're doing doesn't get us the results that we're looking for.
Mm-hmm. So do people self-pay for that part that the insurance doesn't cover?
Yeah, that's the thing. Insurance
Okay.
will not cover the model. That's my issue.
Oh, got it.
Yes, yeah,
Okay.
that is my struggle because it's like because if you look at like insurance will spend $20,000 for inpatient care.
Mm-hmm.
In my experience is people don't tend to come out substantially better than they went in.
Yeah.
It's a really good way to save a life. It's like if somebody cannot stay alive, if there's nobody to help them or they're unable, they're wanting to die, then that is a good way to handle that. But I don't think it's a good way to find real wholeness.
Do you help individuals? Like, what is their primary? Do you diagnose them? Is it substance use disorder or just all arrange?
Well, we do have capacity for diagnosing. My thing is I can absolutely, as a mental health counselor, say, you know, you have all the criteria of these things. But when I think about who's our desired demographic, it would be
Mhm.
anybody with a dysregulated nervous system. And I feel like you can look at that and it's very broad because PTSD, um, mental health workers, public service workers, fire,
Mhm.
police officers, people that have ongoing trauma, veterans, children from the foster care systems, people with behavioral issues, people like, because the whole issue is trauma. Like, that's
Yeah.
the issue. And we don't have a lot of ways that get the body out of that fight, flight, or freeze. And I believe our
Mhm.
program can move you out of fight, flight, or freeze into a better place.
Are there other restores like in other states or is just this one? Does anybody else doing this in other states?
I can't find anyone.
Oh, okay. So, okay. Well, that's yeah, I've never heard like I said, I've been doing this a long time. I'm in recovery myself and we do peer-to-peer recovery support services here. We don't do insurance or any of that. We're a nonprofit, so I'm raising a lot of money and writing grants and doing what we do here. That's interesting. So I guess who came up with the whole model? Is it someone or
I
you
did.
did?
I did.
Oh, okay. Wow. Well, good for you. I mean, that sounds interesting. I'm always learning more and wanting to learn more about the brain and especially like for substance use disorder and trauma. We have a women and children's recovery house, so we have children here as well. And we have 14 recovery homes here at McShin, and then we have this big recovery center that we're at now. And then we have linkage to medical professionals, trauma informed care. They do trauma yoga, like a ton of different holistic approaches. My personal pathway is more holistic. I used to be in 12 step forever, and I wouldn't be alive without it. But the past like 6 or 7 years now, I think, I've been doing more holistic things for myself. And this sounds really interesting to kind of get your brain in order, even with, your diagnoses, but also just life in general. So do you serve people outside of your state? Like, do they come there for the second phase?
Well, like I said, this is new. I've been serving people from surrounding areas in my private practice for years.
Okay.
But Restore is brand new. Like
Okay.
this is like my tell the world about it model because it's
Okay. Well, you're going to tell the world through this, well, at
yeah.
least a lot of people. Is there anything else that you would like to just your average person, stay-at-home mom, whoever your avatar is, about the organization or about what you guys do to try to better get the word out, at least like to provide the services to other people?
I feel like the main thing I want people to know is there's always hope because I often will I'm kind of known for being able to help somebody who seems like they can't be helped. And I just don't ever think that help is not available. I just think we have to look at it differently. And like I said, I've had struggles with our current model, like as a parent, as a teacher, as a counselor, as somebody who advocates for foster kids. I'm like, this doesn't work. I see children who have been traumatized by the system. Like we spend weeks and weeks of counseling on dealing with what happened to them while they were inpatient or while they lived we have a facility here in our town that houses kids, and it's hard. Like what kids go through there is hard. And I think we have to learn to stop the trauma and stop, it's like we have to stop the bleeding, and then we have to provide the things it takes to heal. And those things are not talk therapy, in my opinion. Like the brain has to calm before you're prepared to talk. There has to be real connection taking place. And I've never found anything better than biofeedback to like dim the trauma in the brain to the point that we are able to have meaningful conversation.
Well, this is all interesting. I'm glad you took the time and to reach out to us and get on the podcast. Hopefully this will open, some doors and some minds, no pun intended, but open some minds out there in the world, just to kind of learn more to help people. We call ourselves hope dealers here as well. So, yeah, just to spread a little bit more hope and offer more services for people. So thank you for your time. Steve will put up your website once we get this posted so people can check you out as well. So thank you for all you do and keep, spreading hope out there.
Well, I appreciate you having me. I'm always glad to share.
Of course.
Yeah, thanks for joining us.
Yeah,
Thank you.
thanks. It was great.